Listen up, because we are stepping into the arena for a life or death battle today. You've got a red warrior who is absolutely down for the count, but he hasn't tapped out yet. He's resting on the bottom 99% of the time. He's got a massive crater-like wound near his tail that's been haunting him for 3 weeks, and you've already thrown the heavy-hitting KanaPlex at him with no visible victory. Most people would look at a fish in this state and give up. They'd say it's over. But you noticed he's still eating. And in the world of Betta consulting, that is the golden signal. If he's eating, he's fighting. If he's fighting, we're fighting. We're going to go deep into the biology of this wound, analyze exactly why your current treatment stalled, and I'm going to give you the elite-level blueprint to pull this fish back from the brink. This isn't just about a sore on a fish. This is about cellular repair, bacterial warfare, and environmental mastery. Let's get to work. Let's look at what we're dealing with. You've got a male Betta, a jewel of the Orient, who has developed a significant lesion on his dorsal side, right near the peduncle, which is that muscular area where the body meets the tail. You've been through 3 doses of KanaPlex. For the uninitiated, KanaPlex is kanamycin, a powerful antibiotic absorbed through the skin and gills. The fact that he's finished the course and is still 99% lethargic tells me 2 things. The infection is either deep-seated in the muscle tissue, or we are dealing with a pathogen that kanamycin alone can't quite execute. You've done the right thing by lowering the water level. That's a street-smart move. Bettas are facultative air breathers. They use an organ called the labyrinth organ to gob air from the surface. When a fish is this weak, swimming 5 or 10 inches to get a breath is like a human running a marathon with a broken leg. By lowering that water, you've saved his energy for healing rather than struggling to breathe. But the wound is still there, and the clock is ticking. Before we fix it, we have to understand the why. Why is there a hole in your fish? Why didn't the KanaPlex close the gap? Hypothesis 1. Advanced Columnaris, the flesh eater. The primary suspect here is Flavobacterium columnare. This isn't your mill-of-the-rill fin rot. Columnaris is a gram-negative aerobic bacteria that can be incredibly aggressive. It often presents as saddleback disease, which starts as a discoloration around the dorsal fin and progresses into a necrotic ulcer, exactly what we see in your photo. The mechanics here are brutal. The bacteria produce proteases, enzymes that literally digest the fish's protein. They eat the skin, then the muscle, and eventually hit the spine. If it hits the spine, the fish loses motor control, which explains why he's sitting on the bottom. KanaPlex is great for Columnaris, but here's the catch. Columnaris often requires a synergistic 1-2 punch. Treating with just kanamycin is like bringing a knife to a gunfight when the bacteria are this advanced. Hypothesis 2. Secondary fungal invasion, saprolegnia. Looking at the white, grayish debris inside that wound, we might be looking at a secondary fungal infection. When a bacterial ulcer opens up the slime coat and skin, the fish's immune system is wide open. Opportunistic fungi like saprolegnia move in to feast on the dying tissue. Antibiotics do nothing to fungi. In fact, by killing off the bacteria, you sometimes give the fungus more room to grow. This white fuzz protects the bacteria underneath from the medication, acting like a shield. Hypothesis 3. Mycobacterium, fish tuberculosis. This is the dark horse diagnosis. Fish tuberculosis is caused by Mycobacterium marinum. It is a wasting disease that causes persistent, non-healing ulcers. If the wound has been there for 3 weeks and has resisted kanamycin, which usually shows results in 48 to 72 hours, we have to consider that this might be a chronic mycobacterial infection. These are notoriously difficult to treat because the bacteria have a waxy cell wall that many antibiotics can't penetrate. The root cause, the slime coat breach. Bettas are water beasts evolved for the shallow marshes of Thailand. They have a complex immune system rooted in their slime coat. Any stressor, be it a spike in ammonia, a sudden temperature swing, or physical trauma from a sharp ornament, can breach that barrier. Once the barrier is down, the bacteria naturally present in every aquarium, like Columnaris, see an all-you-can-eat buffet. Your fish is currently in a state of septicemia, or deep tissue necrosis, which is why his metabolic rate has plummeted, leading to that 99% lethargy. The solution. We are moving into phase 2, the recovery protocol. We need to change the environment, change the medication strategy, and boost the internal biology of the fish. The hospital tank setup, zero distraction environment. You mentioned a foam sponge filter and a heater. Good. But if he's in a main tank with substrate, rocks, or gravel, move him to a 5-gallon hospital tank immediately. Why? Substrate traps detritus and bacteria. We need a sterile, bare-bottom environment so we can monitor his waste and ensure no secondary pathogens are lurking. The water level. Keep it at about 3 to 4 inches, just enough to cover the heater if it's a submersible one placed horizontally, and keep the sponge filter running. This minimizes the energy cost of breathing. The medication 1-2 punch. Since KanaPlex alone didn't finish the job, we need to combine it with Nitrofurazone, found in products like API Furon 2 or jungle fungus clear. The science? Kanamycin, KanaPlex, is absorbed internally and works from the inside out. Nitrofurazone works externally on the surface of the wound and is highly effective against Columnaris and many fungal strains. When used together, they create a synergistic effect that is far more powerful than either drug used alone. The schedule? Day 1, dose KanaPlex and Nitrofurazone. Day 2, dose Nitrofurazone only. Day 3, 25% water change, dose KanaPlex and Nitrofurazone. Day 4, dose Nitrofurazone only. Day 5, 25% water change, dose KanaPlex and Nitrofurazone. 3. The nitrogen cycle mastery. In a hospital tank, your cycle is at risk because medications can kill beneficial bacteria. You must understand the nitrogen cycle to keep him alive during treatment. Ammonia, NH3, is fish waste. It's highly toxic. In a hospital tank, it can spike fast. Nitrite, NO2, is the middle step, even more toxic. Nitrate, NO3, is the final, less toxic stage. Because the meds might crash your sponge filter's bacteria, you need to test the water daily using the API Freshwater Liquid Master Kit. If you see ammonia creeping above 0.25 ppm, you must do a water change and redose the medication based on the volume of new water added. Tannins, nature's pharmacy. Go get some Indian almond leaves, IAL, or alder cones. The why? These release humic acids and tannins, turning the water a tea color. Tannins are naturally antifungal and antibacterial. They help lower the pH slightly and promote slime coat regeneration. For a wild betta in the Mekong Basin, this black water is home. It's soothing, it reduces light penetration, which reduces stress, and it provides a mild antiseptic environment for that wound to close. Epsom salt baths, the swelling solution. The wound looks inflamed. Epsom salt, magnesium sulfate, make sure it is pure, no scents or dyes, can help. The method: 1 tablespoon per 1 gallon of water. Do not do this in the main tank. Do a 15-minute dip in a separate container once a day. The science: Epsom salt acts as a laxative, but more importantly, it draws out fluids from the tissue, osmoregulation. This reduces the pressure on the wound and can help with any internal swelling that's causing him to stay on the bottom. Nutrition, the fuel for repair. He's still eating? Great. Stop the pellets for a few days and move to live or frozen foods. The menu: frozen Daphnia or mysis shrimp. The why? Daphnia contains chitin, which acts as fiber to prevent bloat, important when a fish isn't moving much. Mysis shrimp is high in protein and amino acids. He needs high-quality protein to rebuild the muscle tissue lost in that ulcer. If you use pellets, soak them in a vitamin supplement like Seachem, Nourish, or Cellcon to give his immune system an extra edge. Pro tips, the extra value. Even though you didn't ask, here is how you level up from a keeper to a pro. Pro tip 1, temperature stability is king. You mentioned 77 to 80 degrees F. While 79 degrees F is ideal, fluctuation is the enemy. A swing of 3 degrees can be stressful for a sick fish. Try to lock that heater in at exactly 78 or 79 degrees and don't let it budge. Use a digital thermometer for accuracy. Pro tip 2, the darkness protocol. Keep the tank lights off. Light is energy, and energy causes stress. A sick betta in the wild would hide in the shadows of a rice paddy. By keeping the lights off, you lower his cortisol levels, allowing his body to focus entirely on white blood cell production and tissue repair. Pro tip 3, the mirror check, but be careful. Once you see the wound starting to close, meaning you see pinkish healthy tissue instead of white fuzz, give him 30 seconds of mirror time. Why? Flaring at a reflection increases blood flow to the fins and body. It's like physical therapy. It gets the lymphatic system moving and helps flush the system. But only do this once he's off the bottom and swimming a bit. If he's still 99% lethargic, skip this. He doesn't have the energy for a fight. Pro tip 4, avoid the pee myth. If he gets bloated from being sedentary, do not feed him a pea. As we know, bettas are carnivorous insectivores. They cannot process plant matter. Stick to Daphnia for constipation. Your betta is a descendant of the beautiful warrior, the Betta splendens. He comes from a lineage that has survived 700 years of captive breeding and thousands of years in the rugged, oxygen-poor waters of Southeast Asia. That wound is a major blow, but the fact that he is still accepting food means his will to live is intact. You've got the tools, you've got the diagnosis. Move him to that clean hospital environment, start the Nitrofurazone KanaPlex combo, and get those tannins in the water. This isn't just about keeping a pet, it's about honoring the resilience of a creature that refuses to give up. Stay consistent, watch those water parameters like a hawk, and give him the quiet, clean space he needs to rebuild. You've got this, and so does he. Keep your head up, stay street smart about your water chemistry, and let's get that warrior back to his throne.